Hello, everyone, and welcome. My name is Norel Doan, and I am the Director of Marketing at Viking Pure Solutions. And we are so excited today to host a panel about ethical sourcing and supply chain sustainability for ESGs in healthcare. And before we get started and I introduce our panelists today, I'd just like to touch on a couple of points of housekeeping. So we may have time at the end for questions. We're going to try and make that happen for you. If so, please be sure throughout to put your questions in the chat section or in the Q&A section. Both are on the right-hand side of your screen. And the chat section is just a little message box. The Q&A section is the circle icon with a question mark in the middle. So let's go ahead and get started. Claire, would you please introduce yourself?
Sure, happy to. Hi, everyone. Good morning, good afternoon, wherever you're calling from today. My name is Claire Brody. I use she, her pronouns. I am a project manager with an organization called the Healthcare Anchor Network. Healthcare Anchor Network, or HAN, is a 70-plus member organization representing about 40% of nonprofit healthcare in the US. And we have come together to pursue this idea of what we call an anchor mission. And in the context of today, we're really talking about how healthcare institutions can add a layer of intentionality to how they purchase to strengthen the local economies and therefore the local communities in which they're based. So really excited to be with you all today and dig into this panel.
Awesome. Thanks for joining us, Claire. Rebecca, do you want to go next?
Absolutely. Well, hi, everyone. My name is Rebecca Ho, and I am the Environmental Sustainability Program Manager at Vizient, which is the nation's largest healthcare performance improvement company, which represents about 65% of acute care centers across the United States. So my role is part of our broader ESG strategy and really focuses on helping our healthcare systems across the US, again, identify ways to improve sustainability with a focus on supply chain, but of course a scope including a broad number of areas, including energy, waste, water, transportation, etc. So really excited to be here with all of you today.
Wonderful. Thank you so much for being with us, Rebecca. Ralph, do you want to go next?
Certainly. Thank you. My name is Ralph Bianculli. I'm the CEO of Emerald Ecovations. We are a renewable fiber technology company, and I can explain that in more detail later on, but certainly what our objective is to develop new technology in the essentials of disposables that people use every day. With that, we deliver certain metrics that will actually show you your impact, along with a high-profile educational platform that we also utilize for all our clients. And I'm very happy to be here with this panel and excited to hear some of the great things happening in sustainability.
Awesome. Thanks so much, Ralph. Josh, you want to go next?
Great. Thanks, Norel. Good afternoon, everyone. Thanks for joining. My name is Joshua Schwartz. I'm the president and co-founder of Viking Pure Solutions. At Viking Pure, we manufacture a commercial grade piece of equipment called an electrolyzed water generator. It gets installed on site at a customer's location and through a patented process produces two all-natural, green, non-toxic, yet sustainable cleaning and disinfecting solutions. As a company, our mission is to replace toxic chemicals in the workplace, either healthcare facilities or otherwise, using these all-natural, green, and sustainable solutions. So really appreciate everyone getting on the call today and looking forward to the discussion.
Fantastic. And last but not least, our moderator, Monica, please introduce yourself and tell us a little bit more about what we're going to be talking about today.
Absolutely. Thank you, Norel. My name is Monica Mikulski, pronouns she, her. I'm an ESG and sustainability advisor. I've operated in the space, counted the other day, for about 18 years. I have worked across various industries and sectors, but spent most of my career within healthcare, working across the healthcare value chain, helping folks respond to DGSI back in the early days, which today is now known as ESG, to spending 11 years as a practitioner at health systems. Most people today now know as Mass General Brigham and Advocate Health, as well as spending some time at Blue Cross Blue Shield of Massachusetts. I'm excited to be here today because I think topic, and I want to thank you, Narelle, and your team for giving time to this topic. It's a topic that can create value for your organization, a topic that, when addressing the intersectionality, has the potential to multi-solve and drive positive social environmental impact. So our panel today is made up of leaders with deep expertise, as you've heard from their introductions within their respective areas, leaders who have pushed the boundaries, created best-in-class programs, and continue to set high standards and break trails for others. But before we come together as a panel, I'm just going to briefly, ever so briefly, spend some time on introducing ESG, because I do recognize there are some folks who are curious what this acronym means and how it relates to healthcare and healthcare supply chain. And hoping that that's going to set that foundation. Go ahead.
Yeah, real quick. Sorry to interrupt you, Monica. Your voice is coming in a little bit muffled. Is there an adjustment you can make with your audio? Awesome. Let's do that. Thank you.
But anyway, I was just getting into our panel. I'm really excited. We've prepared for an informative and engaging conversation. And with that, if you'll give me just a couple of minutes, not even, on introducing ESG, and we'll jump into it. We've got some really great questions. All right. So ESG, the work, has had several name changes over the years. Since about 2005, the name to call it, right? What is this it that we're doing? Has shifted from corporate social responsibility. Some have included corporate citizenship, depending who you're working with, who you're training with, sustainability, and now ESG, all defining pretty much the same thing, with, of course, some nuances as the work has evolved over the years. It's also important to note that these name changes were in response to political backlash, as it today is in a process of redefining itself into responsible business, if you're following the headlines and the work. I do believe that the work will continue, just as when Trump pulled us out of the Paris Climate Agreement, the We Are Still In declaration began, and you saw that the work continued, if not strengthened, the commitment and progress in France. Anyway, my point is, while there might be a small U.S. faction driving these changes, the rest of the world is moving forward. And Europe recently mandated disclosures. The SEC recently mandated reporting for topics under the E, carbon emissions, and is evaluating some items under the S, for example, DE&I measures. So ESG. E, it primarily represents environmental criteria, environmental stewardship, criteria to assess how a company performs on issues like climate change, resource use, pollution. S are the social criteria that examine an organization's relationship with, say, employees, patients or members, communities, and other stakeholders, focusing on issues such as diversity, labor practices, human rights, and community engagement. Having recently come out of healthcare, this is also, under the S is where pricing and cost transparency is categorized alongside health equity. And the G are the governance criteria that drive the organization's leadership. Things like ethics and transparency and internal controls, including aspects like board diversity, executive compensation, and shareholder rights. And so today our panel is going to speak to ethical sourcing and supply chain sustainability for ESG and healthcare. And before our first question, I'll just briefly further set the stage. For us today, for leaders addressing ESG and healthcare supply chain and their unique challenges, using environmental services as an example. So I often share the story about the past. In working with environmental service leaders. And I don't know how many of you have operated in this space, but when I began my career way back 10, 15 years ago, I was working with someone I describe as an old-timer, someone who's been in the space themselves for about 20, 30 years. And we were introducing green cleaners and potential for healthier, safer products. One of the few challenges that they had defined, which we would categorize in ESG today, was budgeting for sick days. I'm sure that probably doesn't surprise some of you that some of the cleaning products that we would use within our facilities unfortunately made their team sick. Therefore, they had to budget for sick days. And when we were looking at, ESG as a topic, we were thinking about patient safety, team member safety, healthier, safer products. Today, that list of unique challenges has grown. It not only remains the same in that we're addressing patient and team member safety because, patients in healthcare facilities are some of our community's most vulnerable members, but we're also looking for healthier, safer products, and there are challenges that are tied into that, such as understanding what is out there within the market, transparency of your product, what's in the product, and what types of chemical concerns are you addressing, such as those asthmagens or clots, which are making our colleagues sick in the day, and whether or not it was cross prohibited, and if the producer was able to get enough demand to create an economy of scale to then be able to ensure that it would be either cost neutral or beneficial to us as the buyer. There's also unique challenges around training. I mean, I don't know about you, but as a child, I was tasked with cleaning the bathrooms in my household. Never mix Ajax and bleach. I've done that a couple of times, and every time I'm like, oh yeah, that's why. But imagine in these large-scale facilities and institutions when there is a lack of training or a lack of clear understanding of how to use the product, and whether it's like 5 glugs to 2 glugs of water, or you understand where I'm going with that. Other challenges: addressing human rights. Depending on where you source your products from, there are human rights components to address. Under fair labor principles, and even today thinking about modern slavery. And then, of course, there's end-of-life challenges and the waste byproducts, the product that your cleaner came in, and what to do with that. And then, I know there's some things that Claire, I'm going to ask you actually in these first questions to highlight around economic development and the unique opportunity there is to create economic development for the community that you're operating in and who you're sourcing from. And is there an opportunity to support diverse suppliers? So with that, Claire, now that I've put you on the spot here, would love to ask you, what are some strategies for ensuring responsible procurement and ethical sourcing in hospitals and healthcare establishments?
Yeah, I love that question. Thank you so much for it. So just a little bit of context before I jump in. We see, at Han, we talk about this idea of the anchor mission and, really adding a layer of intentionality to how you operate your business, and in the context today, how you purchase. And so we see a direct correlation between this anchor mission framework and ESG and health equity and all these things that tie together. And so when we're talking about supply chain strategies that relate to this idea, we use the phrase impact purchasing as our lens. And so when we talk about impact purchasing, we're talking about prioritizing spending with local, diverse, sustainable, and/or high impact businesses like worker co-ops, B Corps, things like that, wherever possible. It's not to say that a organization is going to be able to shift all of their spend to those types of businesses, although it would be amazing. But when you think about the scale of purchasing within the healthcare sector and the impact that even shifting a small percentage of those dollars can have in the communities in which you're based, it's huge. And so when we realize that opportunity, these all sound like wonderful ideas, but how do you actually make them happen? And so at Han, we try to boil down the strategies into 3 buckets. The first being creating connections, the second being building capacity, and the third being embedding institutional commitments. And so when we're talking about creating connections, it sounds just as it is. It's really making sure that through adding that layer of intentionality, that we're taking the time to connect existing local, diverse, sustainable vendors to contracting opportunities within the healthcare institution. So we know that supply chain can be simultaneously fast and slow. So it really takes a lot of proactive thinking and having a good bird's eye view of what opportunities are coming up so that you have the time to do that matchmaking or what have you. But it also can include hosting outreach and education events, embedding goals around local or sustainable diversity, spending into proposals. And a big thing is thinking about like unbundling contracts to carve out opportunities for those kinds of vendors as well. Because we know that traditional procurement practices can create barriers for those businesses to even enter into the pool. So we're thinking about ways to adjust those internal practices to better facilitate those connections. So that's creating connections. That on the flip side of that, we talk about building capacity, which means that we need to recognize that not every business that could service these healthcare systems is at a place where they can do that yet because they're not at scale or they don't have a key success factor or what have you. And so we need to be thinking also about growing the capacity of existing businesses and incubating new ones. And so this can take a number of approaches, but it could be something as simple as a mentor-mentee program where you're pairing a vendor already performing well within your supply chain with a vendor that you want to upskill. It can again include embedding contractual expectations to subcontract to these types of vendors. But you can also think about the other resources that you have available that are in kind. So that could be as simple as space. It could be sharing your expertise, access to information. All of those things matter and can help really strengthen the ecosystem that you want to see more present in your supply chain. But the third, and perhaps probably the most important, is around the institutional commitments. And so we're really looking at, all these ideas are well and good, but if the policies, the processes, the culture isn't there to help sustain this over time, you're going to be pushing a boulder uphill. A lot of times these efforts begin with one or two people who are sharing that this is important, but if those folks move on from the organization or have something else thrown on their plate, you need to make sure that these frameworks are in place to sustain that work moving on. So this can, again, take a lot of different forms, and it doesn't have to be huge. It could be as simple as looking at your existing policies to see which ones could be modified to better support these types of vendors. Something like net term payments, again, requiring participation from target vendors. But I think as you build your capacity in that space, thinking about things like, what does your evaluation criteria look like for proposals? Does it have sustainability, diversity, local as part of a way that you evaluate bids? Are you attaching these kinds of priorities to performance metrics for leadership within your organization? Is this part of your strategic plan? So that's a lot probably that I just threw at you all, but happy to talk about it more. But I would again say, trying to boil it down to those three approaches of creating connections, building capacity, and embedding commitments.
I like that. Connections, capacity, and commitment. And I appreciate you highlighting some of the criteria or the filtering that you use to evaluate products. I have listed here diversity, local, incentivizing leaders at organizations. This leads me to want to ask you, Rebecca, what are your strategies at Vizient, and what criteria do you set, and standards for preferred healthcare products? Besides, price, sustainability, or is it based on price and sustainability? So I'll just stop right there.
Yeah, absolutely. So as a refresher, what Vizient really does is we help about 65% of acute care centers across the United States identify their purchasing and utilize the Vizient contract catalog to purchase in a number of different areas. So we cover categories like furniture, food, medical, surgical, or perioperative supplies, and so much more. And so part of our role is really to help our suppliers and help our providers not only understand what the more sustainable or environmentally preferred options are, but to also highlight really tremendous work that's already being done. So we collect product level information, or as we call them, attributes, for our different products in all of the categories that I mentioned. And that really allows our providers to have a simplistic and easy way to evaluate, am I purchasing, for example, an exam glove that meets more of the sustainability criteria? And in turn, it also really allows our suppliers who are doing great work in this space to highlight what they are doing in terms of removing harmful chemicals, being better stewards of their energy, of their water, reducing the waste associated with their products. And so when it comes to setting our criteria, we really think about two approaches. The first is collaboration, and the second is specificity. So when I talk about collaboration, we here at Vizient do not want to reinvent the wheel. And so as Claire was mentioning with Healthcare Anchor Network, that is an organization we partner with very closely. We really look at some of the areas they're focused on, the chemicals they're focused on, and try to align that work because we know so many of our providers are participating in HAN and their impact purchasing commitment or other obligations. And so really trying to create transparency and ease around that work is very, very important. And when it comes to not reinventing the wheel, that also can kind of translate to using standards that are pretty accepted across the industry. So for furniture, you can think of FSC certified being one of our different attributes or criteria. When you're thinking about food, you can think about USDA organics. And we include so many more. And then where we really kind of utilize our role as a convener is to help understand what about those categories where there are fewer industry-specific third-party criteria. How do we evaluate what a more sustainable catheter is when there's not necessarily a certification that can be obtained there? And so we've collaborated with organizations like Kaiser Permanente to develop standards around the attributes that we're going to use. And this is really beneficial because if you're part of a healthcare system, you know that the burden of asking each and every one of your suppliers about their product level sustainability is going to be really cumbersome. And we also know that if you're a supplier and you have 300 different hospitals asking you 300 different questions, it's going to be really tricky. And some of that data might fall through the cracks. And so that's where we use our unique position to help make it a little bit easier to access that information. And then the second point that I mentioned was specificity. So one of the things that we really pride ourselves on is we do not have one blanket approach to determine if a product is in fact environmentally preferred, but instead we develop criteria that is very unique to each category. So an example that my team loves to use is that we really hope we don't have to ask if there are heavy metals in your cheesecake that you're buying for your cafeteria, but we might have to ask about that in other categories. So the attributes we are using to evaluate a product are specific to the needs and the issues that that product might have in terms of sustainability. And another thing that we really try to focus on, in addition to that specificity, is innovation within that. So when we look at what we're currently asking about, a lot of our criteria for medical, surgical, or perioperative specifically, right now is focused around chemicals of concern. So do your products contain chemicals that are linked to be carcinogens or reproductive toxins or neurotoxins? And then we're also asking a lot about waste. So is the product recyclable, reusable, reprocessable? And we've noticed that that was our original approach because when we started this work back in 2017, that was really material to our healthcare systems and still is today. But we are evolving to meet the emerging needs of our healthcare systems by starting to think about things like carbon emissions that are becoming more and more at the forefront. But we are really, really passionate about making sure that while we expand our scope and we look at additional areas, we don't play sort of what I like think of as like sustainability whack-a-mole, that we don't so get focused on carbon emissions that we forget the importance of removing these chemicals, or that we don't get so focused on improving our waste that we forget about some of those emission trade-offs as well. And so that's really how we're setting our criteria. We tend to use federal standards, and we tend to really listen to that voice of customer and where the industry is trending, as well as sustainability as an entire area of focus, so that we're making sure that the attributes we're providing are ones that are being universally accepted and utilized, and also working to advance human and planetary health to the best of our knowledge.
I love that. I love that you address this false dichotomy, that it's or when it can be an and really appreciate the flexibility and acknowledgement and adapting to the many different needs based on the categories. I've got so many notes here, but we have two folks on the line with products that are addressing some of these very unique challenges and attributes that we've just highlighted here. So I'm going to start with you, Josh. How does Viking Pure help healthcare organizations to clean and disinfect more sustainably?
Yeah, thank you, Monica. Appreciate the question. And several things that you touched on earlier, and Rebecca, right in line with what our mission is. So just, at a high level, the traditional cleaning and disinfecting model is unfortunately, not sustainable and quite harmful to the environment. So typically, healthcare facilities are buying, chemical products in single-use plastic bottles. They're getting delivered on trucks, obviously with a carbon footprint, in cardboard boxes that need to be disposed of. They have all types of disposal issues in terms of when you have to get rid of those chemicals when they're expired or whatever they're not using in a bucket or bottle, how they're supposed to be, disposed of to not, affect issues, downstream. So the, status quo model, which most people, have thought they have to use because products that are more sustainable or greener, they think are, not as effective. Unfortunately doesn't have to be the status quo, any longer. So with Viking Pure, what we do is we install a patented piece of equipment on site at the healthcare facility, either if that's a hospital, surgery center, primary care office, any facility. Our technology and solutions are the same. We have different size machines depending on how large the facility is. Through this on-site generator, just using water, salt, and electricity, we give the institution the ability to have their own production hub and to produce as much cleaning and disinfecting product as they need, that can replace basically all of their traditional toxic chemicals, and they're doing it all on site. So this becomes kind of a closed loop that's completely, not completely, but almost entirely sustainable, especially as compared to the traditional status quo model. So instead of having all of these, single-use bottles and delivery issues, all, spray bottles, containers, carboys, transfer cards, everything could be reusable because they're just going back to the Viking Pure machine to refill either their cleaning containers or disinfecting bottles, daily. So all issues in terms of disposal of both the solutions down the drain or of the cardboard or the bottles goes away. Obviously, the carbon footprint is dramatically lessened in terms of not having these chemicals produced in large factories and then having to be transported and delivered and driven, across the country. As a company, to date, we've already successfully eliminated about 9 million gallons of toxic cleaning and disinfecting solutions that have been replaced with the use of our products. And that's going up every second, fortunately, across our customer base. A few things that, Monica highlighted, that I kind of jotted down in terms of, other issues in terms of how we're dramatically increasing, safety and sustainability within the healthcare workforce, in terms of the safety of the environmental service workers. So she had mentioned sick days related to, interaction with traditional harsh toxic chemicals. So one of our hospital partners in Florida, they recently, did a study looking at the 2 years prior to implementing Viking Pure. For 6 environmental service workers, they were averaging over 80 sick days a year just related to the use of toxic traditional chemicals that could be nausea, dizziness, vertigo, skin irritations, asthma. And now in the last year, since they implemented Viking Pure, they had 1 sick day. So a dramatic increase in terms of, the safety for their workforce. Also, just in talking about, waste of these products and disposing, that same hospital had calculated that they're now saving on an annual basis 55,000 pounds of, wipes and packaging that they otherwise used to have to dispose of that they no longer have to with Viking Pure. And additionally, 1,000 plastic bottles annually they're no longer disposing of that they're able to just, reuse. And just lastly, in terms of kind of the safety and sustainability, with Viking Pure, the products come out of our machine at a ready to use concentration. So there's none of this thought of, dilution, mixing, chemistry that has to be on site. There's just 2 simple products that are both 99.9+% water, which is why they're so safe for the staff, for the patients, for the physicians, et cetera. And with these 2 products replacing all those traditional harsh toxic chemicals, unfortunately, if they are mixed together, there's no, adverse reaction, no mustard gas created, none of these other, unfortunately, harmful things that sometimes happen with the, traditional chemicals. So there's all these different ways and different, vectors there. Viking Pure is really creating kind of this on-site sustainable hub that's both, making the practice of the production both sustainable and safer for both the patients and staff. So we're excited as we continue to increase our footprint in the healthcare space.
Thank you for that. I heard a lot of multi-solving taking place, which we addressed earlier, and the highlighting of the and between what we've identified and the solutions. Ralph, would love to turn it over to you now. What are some of the ways that Emerald Ecovations and your products can help organizations in healthcare with their purchasing decisions that end or at least significantly reduce some of those environmental impacts?
That's a question we're always challenged with every day, and thank you for that. First of all, Emerald Ecovations really is a technology company evolving around renewable fibers, and because of the evolution of what's going on in disposables, we've taken the high road on where we need to start in order to continue R&D. When we launched our portfolio of products, we started with several dozen products. Today, we have over 300 in a space that is primarily made from non-tree fiber materials. The question always comes, what is tree-free? And the response usually is it's a recycled product. What's interesting is it's not a recycled product, right? It's a renewable fiber harvested from the farmers after they harvest their crops. We take that, and our technology converts that into pulp, and in some cases plastics, and we then create finished goods. It's an evolution that's taken place, and most of the challenges that we see, particularly in new areas that we're looking to venture, and that is the healthcare sector, which we think is a prime industry that is looking for change. Some of the things we need to do is educate. So we've put a lot of effort behind our education. We have an academy built into our platform with almost 2,000 graduates at this point that are industry individuals, both from the supply chain and many from our account base. And we do quite a big job in the financial sector, which is embracing the sustainability movement for a lot of reasons. But the educational piece is very, very important for us. To explain what we do and what our materials are, it does take a little bit of a understanding. And then we complement that with our ability to measure through algorithms we own that actually gives the impact reporting to our clients. And that to us is really what moves the needle for our clients to be able to communicate to their stakeholders what it is they're actually doing to embrace the ESG movement. So products are very, very important to us. And as we move into other sectors of industry, it's exciting for me to find that the other industries like healthcare is quickly embracing some of the things we're doing. But it does require a little bit of an evolution. And I think there were some great points brought up from each one of you regarding the barriers that take place in supply chain. I spent almost 3 decades in the supply chain, so I've seen the evolution, and I've also seen the barriers. And legacy supply chain is something that is probably one of the biggest issues, where we find clients today asking us as a manufacturer to do on-site training, to be in front of their employee base, to be in front of their customer base. And that, to me, is where the connections start, where clients are embracing change. And you can't wait for the supply chain to catch up with these types of changes. It requires, the motivation from the decision makers. Healthcare, we see as an industry sector today that is looking at sustainability, talking about sustainability, and utilizing products that they would consider are sustainable, but yet no one could explain where the origin of those products are. The big difference our company does is we control the supply chain. So we aggregate our raw materials. We know exactly what's in it. We know exactly how it's made. We contract out to 48 manufacturers around the world to produce these goods for us under strict guidelines that we give them with our formulations. So we follow the supply chain from the aggregate right to the finished goods. Our next evolution is to improve compostability, commercial composting, which we all know, and you probably hear in our space, in the disposable space, plastics unfortunately don't have an end life. The plastics recycling industry has failed for decades. 9% of all plastics are actually recycled. Those are the challenges that have to finally be addressed. And with our platform, the final lifelong never dies. We start from cradle and end back in cradle. Our products become compost. So we're seeing a fast road to what's going on in the development of these types of materials. We're very comfortable in, being the pioneer in it. It is painful being a pioneer, I can tell you that. But certainly, being the pioneer gives you a lot of options. We don't have any roadblocks. What we make tomorrow, I don't know. We control the raw materials, so we can produce things that if our clients ask for it, we can do it that way. So it's an interesting thing that's going on in the industry. And we look at things, and, I think some of the most important pieces in our strategy is, and we have three components to it, right? We have innovation, we have education, and we have optimization. Those things are what the 3 pointers that our teams live by every day. So we're very excited to continue evolving into the healthcare sector, and I certainly appreciate having the opportunity to talk today.
Thank you. So I appreciate the introductions you've each provided us as we addressed the unique challenges and opportunities for healthcare. But I think what many of us here are curious is, how do you do the work, right? Typically, our leaders will ask us, what are others doing? What can we do? And how much is it going to cost us? So Rebecca, I'm going to put you on the spot next. What have you found to be the foremost methods at Vizient for introducing more sustainable alternatives to procurement teams, right? To those number of clients, techniques that actually work, and motivate them to convert to more sustainable options. And then Claire, stay tuned, you're next.
No, you bring up some great points. I think, especially as many of us on this call have sustainability in our job titles or in our background, we would love a world where inherently every organization wants to pick the most sustainable or green product. But we also know that sustainability does not exist in a vacuum. There are so many factors that go into a healthcare system's decision on what to purchase. And so something that we've done to try to help combat that and make it a little bit easier to choose a more sustainable option is we're one of the only GPOs that it has included sustainability in value analysis. So we say that when you're choosing a product, you should not only examine the sustainability considerations, but you also need to be thinking about the clinical, operational, and financial considerations. And so something that we're really proud of that we've achieved in the past year is we created a brand new industry first tool that we call our ES Optimized Insights. And it essentially allows our providers to get line item level detail and look at what they're purchasing now, how many of our attributes that product they're currently purchasing meets, and then gives them a conversion scenario that essentially kind of does the work for them to say, how can I find a product that has clinical cross-references, so it's not going to disrupt the quality of care? And how do I find a product that meets more of these attributes, that has fewer harmful chemicals, produces less waste, etc., that also is financially feasible? Because we know it is really tricky to advocate for products that don't have all those components to play. And I think this tool has been really successful for us because there is a myth that exists out there that going green means spending more green. And while sometimes that's true, we have oftentimes found with this tool that there are opportunities for savings by choosing products that do meet more of our sustainability criteria. And it also opens the door for our suppliers to realize that there is a market for these items, that there is really a drive and a need to invest in the R&D to create more sustainable options. And so this tool has been really beneficial, not only to make it a little bit easier for healthcare systems to get insights into how do you choose a product that is more environmentally preferred and logistically make it feasible, but again, creating that marketplace for our suppliers. But it doesn't stop there. We can provide every line item level tool and resource But at the end of the day, it requires someone at the healthcare organization who has the know-how and the power to make those choices. And I say someone, but really I should say multiple someones, because we know that sustainability, especially in a healthcare system, is not up to one person. It is up to an entire team. You need buy-in from your procurement team, from your C-suite, from your physicians who are using these, from the facilities team that are going to have to adapt to a new product. And so something that we've really encouraged and we've been really excited is, how do you start to build green teams? How do you start to set sustainable purchasing policies and understand, if we convert to this product, how do we make sure that our approach is standardized across the organization? How do we make sure that every member of that supply chain team feels equipped and supported to tackle these issues? Because it can't just be one subject matter expert. It can't just be one supply chain team member. It has to be, again, as I mentioned earlier, a collaborative approach. And so I think it's through utilizing knowledge and data from our suppliers and our providers, really simplifying the process, and then again, providing a foundation for that process, for that opportunity to really take root, that we've been able to see some success in this space.
Thank you, Rebecca. I appreciate you touching upon the costs, because I think that is what is most challenging for colleagues. And so I'm going to pivot and transition to Claire, and thinking, and want to ask you the question, how can we cost effectively manage our supply chain and procurement practices while adopting greener technologies, improvements, those sourced by diverse suppliers in our local communities? So thinking about things like the ROI rather than just managing effectively. Excited to hear your thoughts.
I have to. And Monica, just as a heads up, while I'm talking, your mic was fuzzy a little bit. So maybe this will give you, I'll talk for a little bit and we can distract us. So yeah, it's a good question. I'll certainly upvote what Rebecca just shared. We really do need to continue to challenge the assumption that pursuing green technologies or other improvements is inherently more costly. There is so much data out there, both qualitative and quantitative, that demonstrates that sustainability is cost effective. We look at energy efficient buildings, we look at waste reduction and management. We heard those stories from Josh and Ralph today. And so I won't belabor that point, but I think there's so many resources out there to help continue to push against that assumption, to move forward and what have you. And I think a great partner in that space is certainly the folks on the call today. I'll also shout out Healthcare Without Harm and Practice Green Health. They have so many amazing resources that have helped me as a practitioner become more confident as well. So the resources are out there is my first point. I think my second point would be that when we think about ROI, we very naturally kind of take a pretty limited view traditionally and think about financial ROI. But I think there are other aspects that we need to be thinking about that also have a huge impact. Things like reputation and reputational value is huge. I think generations that are coming into the workforce are increasingly choosing their career based on how companies are performing in these spaces, and it matters to them. And so things like reputational value, supply chain resilience, I mentioned employee attraction, retention, satisfaction, all those things can be measured as well and considered when you're thinking about how to demonstrate that ROI. But I think getting a little bit more tactical in terms of, say you do want to adopt greener technologies or a product or something like that. The other more tangible advice I'd give first would be to start small and think in pilots. I come from a tech background, and so I'm very much what's the minimum viable product? Let's build in iterations. Let's think about ways to break this down. So rather than trying to implement everything across an entire organization, could you start with a single team or a department that's already kind of interested in this? Could you, rather than looking at all of your supply chain policies, is there one that you could really focus on trying to improve and build iteratively from there? Because these pilots can be an opportunity to iron out the kinks so that you learn continuously and you can adjust accordingly or what have you. But the other things that I would do is I think Rebecca brought up this point that you can't do this work in a silo. So thinking about your champions, as Rebecca mentioned, on the clinical side, the operational side, all of those things who are the folks who are ultimately going to be using these products are going to be the ones that you need to bring along the earliest. But I would also encourage us to take a more expansive view of that collaboration as well and think about our peers beyond our respective organizations. Something that we talk a lot about at the Healthcare Anchor Network is the power of collective asks. It's one thing if a healthcare system goes to a vendor and says, I would love this thing, but if 20 are all asking for the same thing, that again, to Rebecca's point, it signals that this is important. It drives competition, all of those good things that we would want to see. But that peer engagement across organizations can also help with your own internal ask. All of these healthcare systems are very competitive with each other. And that's okay. Like, competition is a good thing in the healthcare space. It helps us create better products and deliver better care. And it can be something that if you're able to point to your peer institutions who've been able to do X in the sustainability space, those things matter. So I think definitely taking a more expansive view with your partners, leveraging them to be able to point to what they're doing that you want to be able to replicate in your own organization, thinking about your GPOs, thinking about your tier one vendors, and in taking that more expansive view, think about how you can transition those relationships from being a strictly transactional one to something that's more strategic. And if you're not sure, just ask the question. I guarantee for the vendors that are on this call today, you would love for your customers to come to you and be like, hey, we want to do something really big and cool. How can you help us get there? And then lastly, I think measurement is essential. Ralph brought up, I really want to see what, Ralph, you guys are doing in the impact space. Sounds amazing what you're able to deliver to your customers, but being able to measure the impacts of this is huge, and getting across the finish line and being able to sell these ideas. But ultimately, you know, we all know sustainability is an investment in the future. These things are going to cost money upfront and time upfront, but they are foundational for future gains in the industry. So it's always that balancing act of like, can you find that small, quick win so that you can get to that larger impact that you're hoping to achieve?
Thank you, Claire, and thank you all for bearing with me and my headset issues here. Doing my best to rectify it. But Claire, you mentioned something about Ralph and impact, and I was curious, Ralph, to hear from you. How does your organization help healthcare procurement professionals make more responsible purchasing choices without paying more? And then there's an add-on question that we'd like as a follow-up to the introduction. Just wanting to know a little bit more about your products composting, and do they require the right conditions, and or does it need to go to a facility? So, hand it over to you.
Okay, I'll take question one. Thank you. You know, one of the platforms that we built into our program was the diversity of product. Our portfolio is over 300 products, but it consists of multiple product groupings. So we produce goods in our materials from disposables for the food service operations to the facility operations in towel, tissue, and things of that nature. And we do some ready-to-use cleaning supplies, not on the commercial side, but certainly on the ready-to-use, quick use. But saying that, those categories collectively, when we go into clients, we will actually do an analysis of their footprint. Our team will go in, they'll analyze the footprint, they'll analyze the data that they're currently using. We'll take that data and in all the category products we produce, and we would take that data and put it back into what we call a financial impact. Along with that, we offer the actual environmental impact. So converting to our materials, generally speaking, almost 100% of the time, we're within budget. Sometimes we're saving some money. And that's because the way our portfolio works. Again, if someone's just looking for one product, sometimes it makes sense for that operator, but impact-wise, it may not make sense. So we look at a program because if we can bring more products to a footprint consumption that most of our clients utilize, that environmental impact is pretty impactful. So to answer your question in a quick note, we are very, very competitive against any national brand in the space that we compete in. And I'm very proud of that. But that's because we also control the supply chain. That helps us control the cost. So I hope that answers that question. In terms of composting, what's interesting is I just came from a conference in New York City where the financial groups that are investing heavily into companies for their ESG goals are looking at commercial composting as a fast growth area. Again, waste management today hasn't invested in commercial composting because there really wasn't a need until food organics became mandated through a lot of users in large urban facilities. So composting is certainly going to be a growth area. So we do work with as many composting facilities as we can to incorporate our products alongside the food organics. That area is going to grow. So a lot of folks ask us, can we get that full cradle to cradle? And short term, I could say in some areas of the country we can. In a longer term, I say we will. And it's all a matter of getting those commercial composting facilities up and running. And they are building them. There's quite a few investments being made right now. So, but the cradle is really what our clients like. They like the fact that it's a renewable fiber, and its begin state starts with non-tree fiber materials. So the goal for our company is to have a cradle to cradle finish where that product gets right back into the soil. And that is our goal over the next 3 years. But as we scale with clients, it helps us all get there. And we're communicate with the waste management companies alongside our clients. And that's part of the process that is necessary in order to really complete the circle.
Thank you, Ralph. I appreciate that. I know we're coming up on time, Narelle, but I was waiting to see if other questions popped in. And since there haven't, there's one more question that I really want to ask Josh about the technology that Viking Solutions provides. How does the on-site generation of the electrolyzed water cleaning and disinfecting solution have such a long-term effect on the healthcare facility's environmental impact?
Yeah, definitely. Thank you. As I know we're running short on time here, but first, just can say to Ralph, I know how painful it is to be a pioneer in an industry such as this, but it's really so critical for our generation and future generations because unfortunately the government and end users have been way too slow to react to the issues with forever chemicals and plastic waste and things of that nature. In terms of the cleaning and disinfecting space, just to go through a couple of quick stats, it's that we often use. It's terrible that 1 in 3 cleaning products contain an ingredient that's harmful to humans and the environment. Over 6 billion pounds of chemicals are used to produce traditional cleaning products a year. 70% of our water streams in the U.S. contain chemicals from cleaning products. Over 1 billion plastic bottles are thrown away each year. Obviously, as we talked about earlier, traditional cleaning chemicals are delivered on trucks, and the VOCs related to cleaning and disinfecting products affect the air quality, leading to higher asthma rates, breathing issues, etc. The amazing aspect of Viking Pure, Claire mentioned on a lot of times with sustainability initiatives, there's a huge upfront investment. There's a long-term payback. With our technology, what we love to promote is there's no upfront investment, there's no capex, but there could be an immediate savings from a sustainability aspect because basically we can instantaneously remove these harsh toxic chemicals that are having both a environmental impact and all these different aspects with our safe, sustainable, but yet effective solutions. Our disinfectants, hospital grade, EPA registered, our cleaners multi-purpose, approved for all surfaces. So we're not lessening the quality of the solutions that healthcare and other clients are using, but we can basically instantaneously improve their sustainability. And then also, definitely with large scale, healthcare operations also save them cost as well. So, we think in terms of, cleaning and disinfecting on-site generation, especially with, non-toxic Green Seal certified solutions is the future, and can dramatically help with reducing, all of the stats I said in terms of, downstream water issues, air quality issues, plastic waste issues, fuel issues, et cetera. So, we're very excited, for the future, as Ralph said, with more, economies of scale, more customers, our impact can be, even greater, in the marketplace and healthcare and beyond. So we're excited for the future and to keep, doing our part to, hopefully improve the sustainability in the healthcare industry.
Awesome. Thanks so much, everybody. We really appreciate you taking the time out of your morning, afternoon, depending on where you are at in the country. To our panelists, starting with our moderator, Monica, thank you for joining us today. And thanks for your patience and stuff with the audio issues, but I'm sure we'll get it sorted out next time. Rebecca, Claire, Ralph, and of course Josh, thank you again for joining us as panelists. This has been a great conversation, and I'm really glad that we got a chance to connect. To our audience members, thank you for joining us as well, and I will be following up later this afternoon with the live replay from the event, or I apologize, the recorded replay from the event, as well as a couple of resources from Ralph and some others here on the panel. Feel free to reply with any questions that you have, and I'll make sure that those get to the panelists. It's been a pleasure speaking with you today. Thanks, everyone.